Welcome to WHX Insights. My name is Peter Birch. This podcast is powered by WHX Tech. In this episode, I'm speaking to Rashmi Raghavendra, Managing Partner at rcubed Ventures. Rashmi, how you going?
Good morning, Peter. How are you?
I'm really good, thank you. Really excited to have a chat with you here on the WHX Insights podcast. Firstly, provide us some context. Tell us a bit about you and what you do, and maybe also rcubed Ventures as well.
I tell people I'm in Rashmi 4.0 right now.
Okay.
Currently, I'm managing partner at rcubed Ventures, and we invest in seed and pre-seed and early stage startups that are in value-based care, preventative care, public health and planet health. So really trying to disrupt who funds the ecosystem and building the next steps for our healthcare.
I guess that makes sense then. One thing I've noticed from the various versions of prior to 4.0 of Rashmi, no, but the even current state, the continued focus around patient engagement that you seem to have, and I guess that ties in with a lot of those focuses in healthcare that you mentioned that rcubed support as well, like value-based care and whatnot. Tell me a little bit more about how you think about patient engagement, what that means, because whilst we all agree it can be a very important thing that needs to be at the center of care, it's also can kind of be quite a vague and nebulous topic. So help me unpack that a little bit more.
So I come from the consumer world, Apple, Samsung, Qualcomm. That's kind of my past. And so there is no consumer health without the consumer. And I've coined this new term called the consumer patient. What does that mean? It's an empowered patient that actually has insights about their own health in a non-clinical setting, which I think we're seeing more and more of. But also those that can take those insights and do something with them. So to me, patient centricity is the only thing that healthcare should be focused on, because that is the service, that they are in the service of the patient, just as consumer technologies have been in service of the consumer. And so in this new avatar of a consumer patient, what I'm truly hoping is that the technology that is emerging from the consumer space can actually empower the patient to take health into their own hands and direct them into a space where they can collaborate with their physicians and they can collaborate with technology, but they are in charge of their health.
That's really important, that patients have choice and voice in healthcare. And I think about over the years within the ecosystem, there's been various iterations in the way in which technology has enabled that, be it through patient portals or an online capability and everything. I guess in this age of artificial intelligence, what do you see the role of some of those more emerging technologies in giving patients that voice and choice?
So honestly, I think the end goal of any tool, whether tech or otherwise, should be three things. One is better patient outcomes, because that is pivotal in terms of everything healthcare. Number two is really ensuring that it's cost effective care. And what do I mean by that? It's care that the value of the care is the quality of the care. Number three is ensuring that the physicians that are giving the care are working at the top of their licenses, primarily doing not the grunt work, but doing what they've been trained to do. Those are the three primary things that I think of any tools, digital or otherwise, enabling physicians, enabling patients, and enabling the communication between the two of them. And so as a part of that, what I'm seeing right now is really, and it's not new. I know AI is the buzzword and everybody is very excited about it. It's really, we're at the peak, maybe just at the cliff, I would say, of the AI hype cycle, particularly in healthcare. But one of the core things, like remote patient monitoring, which we invest in a lot of companies, they actually have very tangible outcomes. For example, patient in oncology space, that patients that have remote patient monitoring the patient post operation, post chemotherapy, have significantly less, 2.8% readmission rates compared to 13%. Those are those digital health tools that are not in a clinical setting that can still have significant impact on patient outcomes. And now the patients have a choice to actually use these and leverage these. And it doesn't have to only be that they get care when they are in a clinical setting, when they are in a hospital, right? And so that I think is where we are going in terms of empowering the patient with information and knowledge and tools. So the communication between the physician and the patient becomes more seamless, and it doesn't have to be always synchronous. It can be asynchronous. This allows then the physician to also operate, where they want to versus some of the current work.
I'm always interested in, because the technology is there and it's always evolving and will continue to get better. But in terms of remote patient monitoring tools, as you pointed out, and there's other emerging tech as well, which if put into the hands of the patient, then I guess in theory will certainly open up the opportunity for them to engage more with their own data, or maybe even clinicians too. But as we also know in healthcare, what gets paid gets done, and like who's going to pay for it. And sometimes I feel like whilst we have these aspirations or intentions to be patient-centered, depending where you are in the world, the healthcare system and the way in which it's funded and incentivized kind of either jars with it or it misses the mark at some point. What are you seeing, and what's your take?
So honestly, I think that's pretty spot on. Somebody needs to pay for these technologies, right? Or adoption of these technologies. Does it come from an insurance company that is more focused on patients keep being healthy? Does it come from the government? Is it a public sector that adopts large scale these tools so that the populations are healthy? Does it come from hospital systems that want to be more efficient? Who should be paying for this? That's the big question mark, right? I would like to look at that and ask a different question, right? What is the benefit of adopting these tools? Why should we be doing this? Like, there are many things already out there. Why should you be adding another tool to the process? Why should you be adding some of this? And to me, if as a startup, as a company, you're able to clearly, distinctly answer that question, then that's when you should really be building anything. That is like literally the only reason to be building anything. I'll give you an example of some of the work that we've done. I'm a part of University of Washington Engineering, Innovation, and Health, and one of the things that we did was this unique technology called Push Start, which is being able to have access to cardiovascular doctors, even when, especially in emergency cases, even when patients may not have had any previous history of having something like that, right? Those would be important kind of innovations and tools to develop in countries where the second biggest killer is cardiovascular disease, for example. But when you talk about directly empowering the consumer, like a wearable, like your rings and wearables and things like that, at this point, I have a very strong opinion of what they're doing today and what they could do. A lot of them just collect data. They collect data about your sleep, they collect data about your heart rate, they're collecting information about you. Many of them are not suggesting any kind of cure. They're not curing you. You're not getting cured of any disease by wearing a ring. You're becoming more aware, and sometimes that can actually be, for some patients, a burden to know exactly, like in metrics, I didn't sleep well. You kind of know it. Now you have all of these metrics. It can be overwhelming, for example, right? So I have a very strong opinion of what wearables and what is classified as consumer tech do today, which is collecting data about you. That's not curing you. So tracking data is not equal to curing patient, number one, right? That's a very important distinction to make. However, they do have the potential of being able to take that information and put it into care pathways that can impact change. And so I do hope that that's the direction, and we do see, but there are many barriers because as soon as you get into class 2 medical devices, diagnosis, etc., right, the accuracy and the liability become very, very strong. And so in those cases, it is important that you get right, whether you get false positives, false negatives, all of these burdens. And you're seeing many cases today, Peter. I think you already know WHOOP. I don't know if you do, but you're following WHOOP and the FDA, going after WHOOP. There is a very strong reason why they're doing that, right? Because they're marketing it as a wellness device, but it clearly is doing a lot more if it's telling you about your, how often or your risk for AFib and things like that. It's not a wellness device, which is how they're marketing it, which is why the FDA has gone after them, because they have not done the process and the diligence that it needs to be of a medical device. And coming from a medical device background, I can tell you that the burden is much higher. The burden of doing those things, not just, so there is a big aspect of post-market surveillance, which I had to learn as I moved from the consumer world into a consumer health world, because it's not just about deploying a device and just that's the end of it. It's actually seeing how and what the device does on the field. And there's an entire post-market surveillance burden that comes with medical device, even when it is a wearable or otherwise. So I do see that we're getting into that era of holding accountable some of these wearable devices and consumer health devices, not just as wellness, because the technology has gotten very, very sophisticated. This is where, again, we come back to the consumer patient and the empowered consumer patient. You can empower them with knowledge, but then the real change only begins to happen when you inspire them to take action.
No, I hear you on the back to your point around the device, getting approvals for medical devices is not the trendiest of processes, let's put it that way. But the
Definitely not sexy.
yeah, but I wanted to pull a thread on that, on the consumer tech point a little bit further too, because I think that's a really good point, that you're potentially enabling patients with more information in order for something to happen. And I guess in a good healthcare system, we'd want that something to happen with the guidance of a clinician. From a clinician's point of view, more often than not, they've got a lot of information coming at them already. They probably don't want to know over the last 6 months what you rated your mood out of 10 or something like this, and they're not going to put that, doesn't really fit in an EMR. Or like they can't even more interesting insights about like sleep quality. How do they even validate that it wasn't measured? And I guess when you come from an evidence-based background, it's and you're just looking at data, it's like, well, that's nice and maybe that might make you feel good, but I'm going to take my own kind of measurements and diagnostics to then determine what to do from here. So I could see a role with starting a conversation and perhaps even a health literacy component for patients too. But I feel like the promise of these wearables is a little bit more than that.
Absolutely, absolutely. And I think they're maturing. They're also faltering, which means that they're maturing, right? If you're holding something accountable, then you know that you're at a point where use these tools to impact their own health. And so it's fascinating, it's emerging, and I really feel it should be one of those strong KPIs that any digital health startup, AI native, should really focus on being able to. And I this is one of the first questions I ask in any pitch that comes to me as well, because at the end of the day, the goal, going back to the first part of our conversation, is to ensure any tool is to ensure that the patient outcomes are better, right? And we do not have, for these tools, a great way to measure the outcome today. Like I said, it goes back to tracking, it goes back to all of that. There's no great way. Like even when it's a wellness app, are you educating this person enough to take the data that you're sharing, but then take the right action out of it? So I do hope to see PAM, or patient activation measure, as one of the key metric that emerges to track patient readiness in using these tools.
Yeah. Thinking about as more information becomes available, you alluded to this earlier as well, as more information becomes available to patients, think through, each time there's a new version of technology, now you can measure your heart rate differently, or your body temperature 24/7, or whatever it might be.
To know your exact precise muscle mass,
Yeah, and it's
your
like
not just BMI, but your pure
yeah,
muscle mass and things like
how
that.
many hair follicles you have, so all these things. So and then the full body MRI trend as well. There's a lot of
Yeah.
different versions of this where, hey, this is great. We can empower the patient with all this information that they didn't have before, because then they might uncover something that they wouldn't have otherwise have found. But I've heard it referred to as, paying for something like this is like buying a lottery ticket, because the chance of actually finding something is so low. And if you get it, then amazing. But for the majority of people that get something like that done, it's kind of like, now you've just got more things to bring up to the clinician that probably don't need to be discussed. So on one hand, I see there's a lot of clinicians that are like, oh, great, now I'm going to have to be explaining to someone why, even though this is outside of a normal range, it's, for these reasons, based on you, it's fine. But on the other hand, I can see, well, from a consumer point of view, that could be pretty interesting. Or maybe I'll make some life choices that mean that I don't need to even bother a clinician with. So where do you see that kind of, as more and more information becomes available, but then we run this risk of having more and more worried well people?
So I'm gonna sort of set a context of this is a fabulous question. It's very, very deep as well, in my opinion, because we are trying to fit new tools into a framework that, number one, it looks at the patient that was probably the persona of a patient 100 years ago, maybe 200 years ago even, right? And also, number two, it's really looking at treatment. Most of the healthcare caregiving today in that clinical setting is about treatment, right? So here's as you think of the future. In 1900, the average human expectancy. Do you want to take a wild guess?
35.
32.
Oh, okay. I took a
Love
random
that.
stab. There you
Very
go.
few people get it right, so you
okay.
get 100 points.
I'll track it on my watch. No.
Yeah, 32 years. 1900.
Yeah.
I should be dead. You should probably be dead.
Very, very dead.
Yeah.
Yeah.
32 years was the average human expectancy, right? In 2023, do you want to take a guess? What is the average human expectancy?
82.
73.
Okay.
73 years, right? And so in about 1,000 years, you see what we've done?
Yeah.
To human expectancy? That is coming from treating sickness. That is coming from treating sickness. What we're going to in the future, if you're living longer, right? If you're focused on staying healthy longer, it's not about treating when you get sick. It's about not getting to that point of sickness. And this is the beautiful world that is beginning to emerge right now, because data is it's that tip that is empowering patients to discover more about things that they would never know, right? Like you would not know what a particular font size was in 1920 or 30s, when there was no printing press. Like most people were uneducated. But this is very common now knowledge, like Helvetica font or Times New Roman. You know this because you're using it in different contexts. In a very similar way, things that we think of bespoke today, like why do I know my heart rate? Why can I measure my sleep? This is the tip of what we're beginning to hopefully open up, which is longevity, improving health of our populations so that we're a healthier world versus a treatment. So that's kind of the I think the pull and the tug that you're beginning to see. And hopefully, if we get it right, we'll be talking about life expectancy that can go higher, but hopefully health expectancy, better health expectancy that also goes higher. And you're already seeing it. Like I know, in my 40s, I am way more healthier than my parents were, even a generation ago, right? And I know this because I have access to better care. I know a lot more things about myself and my vitals and my health thing, and I take care of it. Teeth, for example, same way, right? Like people would just literally not have their like teeth and just go with like, I'm going to just get rid of it and put on a denture or something. That was kind of the de facto even 2 generations ago. Not so much. We take care, and oral health has a huge impact on overall health. We've been able to prove some of this research. So to me, what you're saying is, yes, the patient is becoming, empowered. They have all of this knowledge, bespoke knowledge now, and then they go to a clinician, especially in the way the current physician world is very siloed by body parts, right? Nobody's thinking of you as a human being. They think of you as an eye or a nose or a ear, nose and throat, or a heart or a liver. They don't think of you as a complete human. Hopefully where we're moving is this aspect of a patient as a whole, and that the patient is sort of the starting point of that and also the center of that.
If we were to start perhaps a conversation for another day, Rashmi, but the last one I wanted to finish on then, for the, you're engaging a lot with the startups or the vendor community or those that are creating technology solutions, be it for consumers or anywhere in the health system. Is there any key advice or things you would hope they do in order to really drive home this need for better patient engagement? And
the first question is, what is the unmet need that you're trying to solve, right? So it's not another tool for another tool's sake. What is the unmet need that you're really trying to solve? And engaging with clinicians is a great way, because that's kind of the world that I'm treading right now as a non-clinician, non-physician, as a technology person, but very deep in the health tech world, right? Engaging with clinicians or experts in those spaces, asking them, what problems they're facing and trying to solve for those real world unmet needs should be the starting point. Not because you've tried this out in a different space and you feel like, oh, this is a consumer thing, I'm pretty sure patients can use it, and try to port that into, you see a lot of this with ERM softwares that are coming up, or chat bots that are being imported from, consumer space and retail space into the health space. It's not a slam dunk. It's not a slam dunk. The second aspect, it's very complex, and this is coming from my personal experience. So engage with people that have worked with, the payer ecosystem, the insurance, the health systems. They all have very conflicting at times objectives and metrics. And so really trying to understand that is important, because then who are you trying to solve this problem for? Is it the patient? Is it the provider? Is it the payer? Who are you trying to solve this problem for? Because all of them do not have the same goals, even if it is in the same ecosystem. So I think having clarity on, what is the problem you're trying to solve, really being, grounded in the real world unmet need, and then having absolute clarity. Who are you trying to solve this for? Who are you solving this problem for? I think is very important. And those are always the three questions that I ask any startup before they even pitch. Like, do you have this? If you do, let's go. If not, then get me the answers, and then we can go.
Such great advice that I hope people take on board. And there's been some really interesting things that we've unpacked in this discussion. I'm sure we could do more in a subsequent chat. But Rashmi, we'll have to leave it there. Thank you so much for joining me today.
Thank you, Peter. I really appreciate it. And thank you to WHX for this opportunity.
And thank you for joining us on WHX Insights. Make sure you subscribe on Apple Podcasts, Spotify, or YouTube so you can catch all the future episodes. My name's Peter Birch. I'll speak to you next time.